Hi there, thanks for joining us for Registry Performance Insights. My name is Kathy Feltz on behalf of Q-Centrix. I've got Lauren Shannon with me here, and I am the Vice President of Customer Experience. I work with a team of folks that partner with about 600 customers throughout the country on their quality data management. And Lauren Shannon is our Senior Manager of Product Management. Today I'm going to be talking to you about some registry performance metrics, and those are performance of your team, not outcomes, nothing that you would get from the registry organizations. So it's definitely a different perspective on registry performance. And then Lauren Shannon is going to share with you how we obtain those metrics and give you a little bit more information around technology. So without further ado, I'm going to go ahead and get started. Just a quick note about who we are at Q-Centrix. For those of you who don't know, we partner, as I said, with more than 600 hospital partners throughout the country. We have about 1,000, and we continue to increase this number, but we have 1,000 folks that are remote abstractors throughout the country. They dial in to EMRs of our partners. They do about 2 million case abstractions each year, and of those case abstractions, we work in regulatory as well as registry and infection prevention cases. And on the screen, you can see we do about 250 different national and local registries. On the bottom of the screen is a sampling of the registries that we do, but I tend to say that we have about 4 pages of registry names for which we have expertise within our organization. So I rarely find that there is a registry that we cannot support. Just to give you an idea of our breadth of experience. And we partner with 8 of the 10 largest health systems. So that's who we are, and that's how we're able to come up with the data that I'm going to share with you today. So first off, the reason that we're sharing these registry performance insights, each year Q-Centrix puts out a report. We call it Healthcare Quality Industry Report. It's data that we obtain through primary research surveys to CNOs, CQOs within different hospital settings that kind of indicate what's going on within the registry, regulatory, infection prevention setting, where there's growth, what are the typical barriers, et cetera. And this year, in addition to updating that report, we're also going to be turning the focus internally to our own data, adding some performance data from our own aggregate numbers. So next slide I'm sharing with you is typically what we would share in our report. So this gives you some insight into the average number of registries per hospital. As I said, the top reasons for those registry participants. And then on the bottom, we tend to give you some direction on why there's growth in registries and the importance of registries. And this is just a quick snapshot of payers linking registry data to coverage decisions. So that's the type of information we would typically put out with our annual report. This year, we're going to be putting in a little bit more abstraction performance data. Oh, sorry about, there's a tiny error on the screen, but hopefully you can bear with me. The way in which I'm going to present the information today is in the setting of an average hospital. So on the right-hand side, I define what an average hospital is based on our aggregate data. It's going to be a short-term acute hospital with about 248 beds, so I'll say 250. And on the right-hand side, these are the data points that I'm going to share with you today. So the average case time, we're going to look at 4 very popular case types and tell you how long it takes based on the data that we have for a typical facility to abstract that case type. After that, we'll give you the average case volume for that size facility, and we'll do the math to give you the hours per month if you're abstracting at that case time it takes for a facility. Efficiency offset, this is an algorithm that we've obtained to determine just switching costs. So most of the folks that we work with have an FTE doing abstraction in addition to other activities. So we've developed an algorithm and validated it with our existing customer base to determine how much time that switching cost takes. So that will be in addition to the hours per month. And then one thing that we hear about all the time is our quality program. Our quality program within Q-Centrix includes what's called an inter-rater reliability review validation. And that's when we abstract a case, we have a sampling algorithm whereby after we've abstracted it, we will go in and validate those answers for a certain sampling of cases to ensure that we're reporting accurate data. And then the last metric we'll give you is based on all of these data points, how much time an FTE will be spending on PTO in addition. So this is the way in which we determine how much time it takes or how much time folks in hospitals are taking today to do the abstraction. So without further ado, I'm going to go ahead and get started with our first case type. So cath-PCI version 5 is something that's, when it came out, it was really interesting for everyone to kind of estimate how long it will take to abstract a case. So this is some data that we were really happy to share. On the top, we have 130 minutes per case. That's the average time it takes to abstract a cath-PCI version 5 case. The average volume that we're seeing in aggregate from our customers is about 38 cases per month. So you do the math and you would come out to 83 hours per month. The algorithm that we determined, as I mentioned, the efficiency offset, that switching cost comes out to 12.45 hours per month. And that's in addition to the hours per month that they are spending abstracting those cases. To do validation on those cases, to have a quality program whereby you sample those cases and revalidate the accuracy of the data would be an additional 11.21 hours per month. And then we estimate that an average FTE doing this work would take about 9.55 hours per month for PTO. So doing the math, the total hours per month we come to for an abstractor of cath-PCI version 5 at an average hospital is about 116, well, it's exactly 116 hours and 23 minutes. So we're going to do this for 3 more case types. Chest pain MI, full data set. There's several different versions of chest pain MI. In this example, we're using the full data set. So we have determined that it takes 147 minutes to do each case. Average case volume is about 26 cases, 25.58 hours per month. Doing the math is 62.68 hours. The efficiency, the cost of switching is about 9.4 hours per month. And the quality program, that IRR validation, is 8 hours and 8.46 hours. And then last but not least, about 7 hours per month for PTO. That totals to 87.75 hours per month that the abstractors are doing on chest pain MI. The next case type we selected was Get with the Guidelines stroke. Comprehensive. Again, several different types of case types here. We selected comprehensive. So the average case time here is 151 minutes. Case volumes coming in and around 26 cases per month. Hours per month, doing the math, 67.39. The cost of switching comes out to 10 hours. The validation process, 9 hours per month, 9.10. And then again, the time that we estimate the FTEs are taking on PTO per month is about 7 hours, coming out to 94 hours and 35 minutes. The last case type we're going to use is STS-ACS. So with STS, the average case time is 267 minutes per case. The average case volume is 18. Doing the math, that comes out to about 80 hours per month. Efficiency, so that cost of switching is about 12 minutes. IRR, to do the validation, to make sure that data is accurate, is coming out to 10 hours and 10.81 hours. And PTO time is 9.21 hours per month, coming out to a total of 112 hours, 112.14 hours. So all of this data is really interesting because it's not something that you'll see in most of the technology on the market today. This is something that we analyze to ensure that our team is working efficiently for our partners throughout the country. But it's also something that we've received a lot of feedback from our partners that they're seeking, to understand how many FTEs they would want or they would need to support their clinical registry strategy, and then just overall, like how their FTEs are performing against the average. So this is data that we're planning to share during our annual report, but it's also data that folks are going to need just to really manage their internal business on a day-to-day basis. So what we thought we would do now is kind of share with you how we have managed to obtain that information. We use a technology called Elevate internally, and Elevate is part and parcel to our, it's actually an add to our universal registry capture and submission technology. So we'll share a little bit about that as well. And so without further ado, I'm going to go ahead and turn it over to Lauren Shannon to share with you those technologies and how that's done.
Great. Thank you, Kathy. So as you can see, there's tremendous insight that we gain from this information as an organization. It's quite literally how we run our business. And so we, again, embed that in our technology. And before we walk through the technology, I think there's a couple of things that we should go over around background. So Q-Centrix was really founded focusing on the core measure side. And as healthcare evolved, we not only saw an emerging growth in the registries, but we also saw a shift in hospitals and how they were purchasing and aggregating their data, many at the enterprise level. And so we built our own capture and submission tool, which again, we call Universal Registry, to solve these problems. And historically, with our model, hospitals could only use our technology, Universal Registry, if you also had our services. And we were very successful the past few years with that model, particularly because of the insights hospitals gain from their registry outcome with the analytics included in Universal Registry. Our emphasis on that clinical data stems from our understanding that it's a critically important resource for hospitals. We know you all are using this for quality improvement, payment to physicians, reputation management, future revenue generation, and so on. And so the more accurate it is, the more valuable it becomes. And we really think that accuracy hinges on the workflow that's used to collect it. And so that's, again, exactly what we're launching today. It's the workflow tools that we've used the past 10 years to manage millions of quality transactions and, again, thousands of quality information specialists. And it's the framework that's embedded in our technology that Kathy had shared gives us that insight that we walked through. And again, we call this Elevate. And there's some key concepts to understand before we get a little bit further. So Elevate is the workflow piece, and then Universal Registry is, in this case, the cardiovascular capture and submission tool. So Elevate first. This does not exist anywhere else. No other companies have their services embedded in their technology and can scale like we can here at Q-Centrix. This is where our team's logging in. This is where we're managing our work, again, running our business through tracking time, tasks. We can perform quality checks. And it's, again, a really powerful tool that creates a really deliberate process and allows our teams to literally work anywhere in the country. And most importantly, like Kathy shared, it drives quality. And so having that high fidelity data set will give you the confidence you need to use your data in some of those activities I mentioned, like revenue generation and reputation management. On the other side, there's the Universal Registry, which is, again, the capture and submission. We're certified for about a dozen cardiovascular registries with this technology. And again, it was designed as an enterprise solution that is extremely intuitive to not only enter the data and be able to submit it, but to give you your outcomes and let you get down to those patients that you need to review in that actual data very quickly. And then further with our technology, we aspire to go outside of cardiovascular. So we've already started thinking about how can we capture oncology data or trauma data. So with that, let's switch over to the demonstration. We're starting on our case list. So to set the stage, this is really the starting point. This is where cases are being uploaded into the tool. And at that time, you or your manager or whoever is doing this can assign it out to your different team members And then you can also set deadlines on these, and we'll show you why some of that's relevant in a minute, particularly on the reports. If you're an admin, this is really providing you that visibility you need to see not only across your different registries, but if you're part of a system, across your system, where each of these cases are in the pipeline. And then again, if you are the one doing the work, this is your work list. This is where you see what you have to do for the day or for the week, and allows you, again, insight to be able to figure out where to start. So when you're ready to go ahead and do your data entry, you would open up your case here, and this is where we're managing all of the activities that we're tracking around our different cases. And so a lot of this is tying back to the metrics that Kathy had shown you. I can add things like how long I'm taking on my abstraction. I'm able to put any tasks around quality checks like fallout reviews in here, and literally track the number of minutes that I'm spending on this information. And then further, you can use this as a collaboration tool with your team members. So you can reassign cases to be able to take a second look. You can make notes, comments, and be able to really work through your cardiovascular cases here using this workflow tool. And then I can seamlessly go straight into Universal Registry, which is again the capture and submission piece. And you can see we're using our CAP-PCI questionnaire, and we'll talk about the journey through the abstraction and all the way through the analytics from the Universal Registry tool. So a few things I always like to point out on the CAP-PCI, or I'm sorry, the data entry for Universal Registry. You can see it's a really clean UI. You can easily jump between sections on the left-hand side. You've got what we call our validation tools, showing you any elements or areas that you need to correct before you submit your data. You've got your coding instructions built directly in the questionnaire to aid during the abstraction. And then further, we've been doing a lot of automation using techniques such as machine learning and natural language processing. And so what this means is whether data is manually being entered in the tool or coming in through an interface, we're reusing that information. Even unstructured data, we're able to perform natural language processing on to determine what pieces to use for these elements. And so our pre-population is providing you that evidence during the abstraction of why elements are auto-populated during your data entry to add that efficiency. So once the abstraction's completed, I can then seamlessly go back to my workflow, and I can stop my abstraction time or reassign this to any team members and then move on with, let's say, my next case. So really easy to navigate. All right, so let's transition to the reports. This is the exciting part. This is the payoff for all of that information that you're asking your team to collect. This is giving you leverage into, again, your process, and it's really the secret sauce behind our organization, how we're getting those metrics, and again, does not exist anywhere. So with your Elevate component, the first thing you're gonna see is your progression dashboard. So you've got all of your different registries across the top here, and it's giving you insight to volumes and how far along you are in any of those cases. And even at an enterprise view, you can see I've got multiple facilities lined up in my dashboard, so I can see across the board how far are we getting with our cases. And then if you recall, all of those activities like the abstraction tasks and the fallouts, that's all flowing into your workflow page, where you can gather insight on abstraction times for your team members, volume, turnaround time to complete cases. And something that's really important to note here is this isn't meant to look over your team's shoulder. This is truly meant to drive that productivity and help you further and make sure you have the right size investments for your different teams across the different registries. All right, let's switch gears over to our clinical outcomes. So the reports we just looked at here, these are tied to Elevate. And the reports we're gonna look at now, these are tied to Universal Registry. So the data that was being entered into that CAP-PCI questionnaire. This is giving you a real-time view into your CAP-PCI outcomes, and further gives you, again, that enterprise view if you're part of a system. And these are designed to get you to actionable data quickly. With our reports, we structure these where you've got your standard registry outcomes. So in this case, your NCDR outcomes are here on the right-hand side. We license these by NCDR, so it's exactly how you would see it in your report. And you can drill down on any of these standard metrics and get down to a list of patients that you need to review for any of those. And so that's likely part of your process. And so what I'd like to focus on in this demonstration is our CAN reports on the other side. CAN reports I like to consider really above and beyond your NCDR outcomes. It's going to give you insight to things like your intra-post procedures or maybe some of your risk factor trends. And then the one we'll look at today is your physician scorecard. This is including volumes for your different physicians across your different facilities, and it's looking at the key metrics with CAF PCI. And so many of our partners are using this data for monthly or quarterly meetings with their physicians. You can easily select any of your operators here at the top to be able to drill down on their information and switch over to what we call our individual view for a really nice executive summary. We know folks want to share this information with their physicians and they want to be able to quickly get it to them. And so this individual view, it makes a really nice PDF that you can pull out of the tool and share amongst your physicians to really facilitate any performance improvement or physician engagement that you're trying to facilitate across your hospitals. So that really covers our demonstration. If there's one takeaway from this discussion so far, it's really the data that we're talking about is extremely valuable and has unlimited potential to improve your organization, impact your outcomes, and your financial performance. So it's really got to be accurate. It's got to be up to date, and it's worth your while considering how you're managing that process or consider managing it in a new way. And at Q-Centrix, we have a strong belief that you should be using the best technology to do that. And so with our solutions, there's a lot of flexibility on how you can package this to fit your needs, whether it's just the technology or our services. We're really able to cater to whatever process you have in place. So again, we hope this discussion today really helps you get to think about what you can do with this data. What would you do with a report that could give you insight to maybe your case progression or the ability to measure your team and your quality? So with that, Kathy, I'll hand it back over to you to see if we have any questions.
Sure. So it doesn't look like we have any questions, and we're always available if after watching this, maybe you have some questions about the way in which we arrived at those numbers. Obviously, you saw how the technology aided our discovery of those top four, and I really encourage everyone on the call to stay tuned, keep your eyes peeled for the report that's coming up in January. It shares a lot more of that insight, but you're going to need to know in order to manage your business how those numbers compare to your own facility, and if that's the case, then you're going to want something similar to Elevate. There's just really nothing else on the market. So with that, I'm going to go ahead and close the webinar. For anyone who's interested, you're welcome to reach out at info@q-centrix.com. If you have any questions or if you want to continue this dialogue, happy to do so. Thank you to everyone for tuning in and have a great day.